Good communication is essential in every profession. Of course, the level to which communication is used varies from job to job. I plan to go into the field of nursing, where the quality of communication could easily mean life or death. Nurses use communication with patients and their families to make sure the patient and family feel informed and part of the process of patient care, facilitating and maintaining that extra support system along the way. Nurses also communicate on their coworkers on a personal level to maintain cohesion in the workplace. On top of that, they communicate with coworkers to make sure everyone is on the same page with the medical side of patient care. The University of New Mexico says it best in their September 2016 article, Importance of Communication in Nursing. Nurses act as the hub of communication, relaying and interpreting information between physicians, caregivers, family members, and patients. Communication is one of the most important skills to have in the nursing field. While doctors may be conducting their rounds, moving from patient to patient, nurses stop to take the time to deal with a patient's concerns or questions. Nurses interact with patients more closely than doctors tend to, which leaves them in the position of being more of a caregiver. Using communication skills, nurses will adjust their technique from person to person to offer more efficient and compassionate care for each individual. Each person is different and needs a different type of care in order to improve mentally and physically. A practice nurse will interpret as well as use verbal and nonverbal communication in order to offer the best care they can in their scope of practice. Patients can be under heavy stress when they are in the hospital. According to Nicole Kraut, an RN, in her February 2017 article, The Importance of Communication in Nursing, explaining processes or certain tasks puts patients more at ease because they understand why something is happening. I believe that if a hospital or clinic did not have nurses, it would lose its heartbeat. The very essence that keeps the building alive with life and passion is the nursing staff. Nurse care goes beyond a mere visit to obtain vitals and gaining information to assist the doctor in diagnosis and care. The nurse may be the person that comforts you and decreases your stress so that you may heal and recover faster and more efficiently upon discharge from a facility or private care. Quality of care may begin with the nurse, and it is vital for trust moving forward in the process that the groundwork is established. Empathy and sincerity assist the patient in allowing themselves to be completely dependent on the process of healing. The nurse can ease this with their demeanor and attitude, which aids the body in healing itself. The nurse may be instrumental in this healing if she helps you to feel as if you are in a home away from home, a mother caring for a child, a father caring for a child, or a grandmother caring for her grandchildren. A loving environment in which to heal is only one of the main purposes of a nurse. If you've ever worked in a job with other people, you know how important communication is. Good communication between coworkers leads to higher satisfaction in the workplace. This is important especially in a profession that is highly stressful and fast-paced. Optum states in their article, Why Communication Practices Are Important in the Workplace, that communication in the workplace improves overall morale and empowers the employees. This is because if there's good communication flowing down through levels in the workplace, it sets a common goal and makes employees feel more secure with the information they are given. Having good communication going up the ladder is also necessary because managers and other supervisors need to know what is happening in the hospital. This is especially important in a workplace such as a hospital because of the severity of a wrong decision. Possibly one of the most important reasons communication is essential in the nursing profession is due to medical information. Nurses are often left with the responsibility of ensuring patient care. Doctors have large numbers of patients that they encounter and deal with each day, while nurses generally have a smaller number of patients they are more involved with. This means that nurses know their patients and the specifics dealing with their case more than the doctor would. Due to this, nurses are essential in ensuring that medications aren't clashing with other medications, doses don't get confused, and much more. As laid out in the above, communication is important in the nursing field for many different reasons. This includes nurse-to-patient communication and nurse-to-coworker communication. Nurses communicate with patients to relay medical information, along with being almost a second family or support system for the patient. They need to communicate with coworkers to keep the hospital running smoothly and safely. Good communication in the nursing field is essential due to the level of importance of what the professional includes, which is medical. Communication is one of the most important skills to have in the nursing field.